purpose of this video is to help you understand the importance of offloading, the use of special footwear, and helping your foot ulcer heal as quickly as possible. Healing quickly can reduce your risk of developing serious complications. Key elements for successful healing are rest, eat a balanced diet and maintain your blood sugars in a controlled range, wear the device your doctor tells you to wear at all times, and refraining from smoking. Foot ulcers need rest in order to heal. If you were to break your leg, your doctor would tell you not to walk on it. It is the same with your foot ulcer. We rest ulcers by taking off the load, or offloading the ulcer using special casts, boots, or shoes. The possible complications from a foot ulcer that fails to heal are development of an infection, infection spreading to the rest of the body resulting in hospitalization, amputation of the foot or leg, or even death. Foot ulcers put you at considerable risk for amputation. Amputation of part of your foot or leg can lead to changes in your ability to do activities that are part of your everyday life. It can lead to a decrease in activity, which can weaken your heart and body, making it difficult to control your diabetes. It can also change the way you walk or move, potentially causing damage to your other foot and leg. Most importantly, the challenge of having an amputation can lead to depression and sadness, affecting how you are able to enjoy your family, friends, and hobbies. Normally, your body's response to pain is a sharp reflex that allows you to recoil and prevent further injury. Diabetes causes changes to the nerves in your feet and the ability to feel or sense pain. It robs your body of the protective gift of pain, or the ability to protect itself. This condition is called neuropathy. People with neuropathy can walk with a stone in their shoe and not notice it. This could cause an ulcer or blister on their foot. A person with neuropathy does not know that they have a sore or blister on their foot because they cannot feel it. By the time you notice the ulcer, it can become very serious. This is why it is important to check your feet every day for problems. Diabetes can cause the skin on your feet to become very dry, creating cracks that later become sores or infected. Ask your doctor to recommend a good moisturizer for your feet and heels. People with diabetes can also have changes in their leg and foot circulation. This reduces the oxygen, nutrients, and blood supply to your leg, increasing your risk of getting an ulcer and slowing your ability to heal. Your doctor may order a test to examine your circulation. Because of these factors, simple everyday activities such as walking or standing on your injured foot can be harmful to your healing ulcer. It could worsen the condition or cause infection. If you smoke, it is important that you talk to your doctor about treatments to stop smoking. Smoking is a large reason why people develop circulation problems in their legs and feet. Continuing smoking will slow healing to your ulcer and likely make your circulation worse. The best way to heal your diabetic ulcer is to take off the load by using special casts, boots, or shoes. It is important to wear these all the time, even if you are only taking a few steps. The best way to heal a diabetic foot ulcer is to use a special cast called a total contact cast. Research shows that more people treated with total contact casts heal than with other treatments. These include bioengineered tissues, such as growth factors or synthetic skin substitutes, and negative pressure wound therapy. They also heal faster than with many other of the newer advanced wound healing technologies. People treated with total contact cast heal in an average of 42 days.
So next I'm going to make this irremovable by adding on a layer of cohesive bandage.
Your doctor can also adapt your diabetic walking boot so that you cannot take it off. This has been shown to be just as effective as a total contact cast. Your doctor may use a combination of wound and offloading treatments to best heal your ulcer. It may be scary to think of your ulcer being in a cast where you can't see it, but the cast helps even out your weight so the pressure is not just on one part of your foot. Your doctor will change the cast every few days and even up to once a week if your ulcer is healing well. When a person breaks their leg, they don't tell the doctor that the cast is awkward or ugly and ask for another way to heal their leg. They know that wearing a cast and resting the bone is the best way to heal it. Likewise, it is important to take the pressure off your ulcer so that it can heal. Wearing your offloading device for every step will give you the best chance to heal your ulcer quickly. Your foot ulcer heals at the rate of about 1 millimeter per day, or about the width of a dime. Going barefoot is another way to seriously risk further injury and complications. In the comfort of their own homes, patients either forget or choose not to wear their offloading device or protective footwear for a few quick steps around the house or across the room. Don't do it. Every unprotected step is a day of healing lost. Going barefoot will slow your healing and make your foot ulcer worse. You may think that one step here or there without the offloading device will not harm your ulcer. You may think that it is all right not to wear it for a couple of steps when you get up to go to the bathroom. What you may not realize is that every step that you take without your offloading device is a day of healing lost. You need to wear your offloading device all the time. You don't want to go backwards, and you want your ulcer to heal as fast as possible to avoid or help prevent complications. Proper offloading, using prescribed slippers or shoes with proper orthopedic inserts, greatly reduces high pressures on the bottom of your foot that can result in loss of healing, reulceration, and complications such as infection. Once you have had one ulcer, you are at a higher risk for another ulcer. So once your ulcer has healed, you need to protect the new skin so that it becomes strong, and you need to protect your foot from new ulcers. Once your ulcer is healed, you may think it is all right to start wearing regular shoes again or even go barefoot. Unfortunately, even though your ulcer is healed, you should still never walk barefoot, even at home. By wearing your diabetic footwear, you protect your foot from high pressures and the danger of injury due to neuropathy. Injury can result in another ulcer and possible infection, with all the complications that go with it. Your doctor may prescribe specially fitted shoes or orthotic inserts to continue to offload your foot and protect it. Remember, diabetes can change the bones in your foot and create spots of high pressure while you walk. These high pressures continue to exist even after your ulcer is healed. Continued proper offloading greatly reduces these pressures on your feet that can cause re-injury. Ask your doctor about shoes or inserts that are specially fitted to your feet. Insurance will often cover the cost. Improper choices of footwear to events outside the home environment are a major cause of foot ulcers recurring. Fragile, newly healed skin is not accustomed or equipped to handle the demands of a social event. It is very tempting to put on those dress shoes for just a few hours. Don't do it. Plan to use and wear your diabetic footwear for all of your activities, including social events. If you have a question about what you can or shouldn't wear, ask your doctor. Remember, important factors that help heal your ulcer are keeping your diabetes in good control, eating a balanced diet, stopping smoking, rest, wearing the device the doctor tells you to wear at all times. It is the goal of your doctor and healthcare team to help your ulcer heal as quickly as possible to minimize events such as infection, amputation, and possibly death. To do this, your doctor has prescribed an offloading device to take off the load from your ulcer. The good news is that healing is possible for your diabetic foot ulcer.